This is Dr. James. So let's talk about umbilical hernias. To some degree, all babies are going to have an umbilical hernia. Let's think about it, so why this makes sense. We have the umbilicus that's attaching mom through the placenta to the baby. It goes through the baby's abdomen. Well, when that cord gets clamped and cut, those vessels are still going through there, and then the cord falls off. Well, there's still sometimes a little hole where the skin covers it, and you'll see this little bulge come out. Now, most of the time, this is just going to go away. But as the hole gets smaller, the pressure goes up. And as the baby's moving around and trying to roll over and eating and trying to poop, they're increasing their intra-abdominal pressure. So then it pushes and it causes the skin to bulge out. Think about like when you had a garden hose and you were watering, and then you put your finger over the tip of it and it increased the pressure and it made the water go farther. Well, that's sort of the same thing. That increased pressure as the hole gets smaller makes the bulge get bigger. So the size of the bulge that's coming out doesn't necessarily go along with the size of the hernia. It is very, very, very rare for a baby to have any complications related to their umbilical hernia, because the hole's too small for intestinal contents to come out. The only thing that's coming out is fluid. I usually refer to it as my rule of thumb. If I can't stick my thumb through the hole in the beginning, it's probably going to go away on its own. Now, most of these go away by the time they're 2 years old. And if they're small, it's much faster than that. If they're still there at 2, then there is a chance that we'll have to get them fixed. But most of the time, we wait till they're 4 to 5 years old. Why the wait? Well, a lot of times, some of them will still go away. But then the other reason is, since there's no real complications, why not wait until the risk of general anesthesia goes down? And that definitely takes a plunge around that 4 years old. So that's the reason we wait. And give it a time where just Mother Nature can take care of it itself. So if you see that bulge, ask your doctor about it. But it's probably not something we're going to really freak out about, because most of them are going to go away on their own.